Hello everyone, my name is Moshe Appel. I'm a clinical psychologist and I have a group practice called Appel Psychology Center where we specialize in treating anxiety, depression, and OCD. And I also post videos on these topics, so if you're interested, you can check out my website, adopsychologycenter.com. So the name for today's talk, or tonight's talk I should say, is when or how to know if your therapist is right for you, or how do you choose the right therapist? And so this really breaks down into two questions. Number one, how do you choose the right therapist? And number two, how do you know when to stick with your therapist, or is it time to make a change and change therapists? So let's first begin by recognizing that if you're debating this question, you're already at a point in your life where you are probably very vulnerable. You're in a lot of distress or dysfunction, you're vulnerable, you have no energy, you might feel hopeless, and so it's the worst time to have to make such a decision and figure out who the right therapist is. Number two, another challenge is that there are so many options. There are different modalities, there are different therapeutic approaches, there are different personality styles, there's medication, there's therapy, there's so many options to choose from. Number three, there's a big financial component often when it comes to therapy because it costs money usually. Number four, there's a time commitment, and sometimes it's a lot of time. It could be, weekly, it could be a few times per week. And it's not just about how much time, it's fitting it into your already busy schedule and getting the energy to go to therapy. And the fifth challenge is that in addition to needing a good therapist who knows their stuff well, you also want to make sure it's the right fit for you. And the right fit isn't just about their clinical expertise, but it's also about their personality and how well you can connect with them. So there are a lot of challenges when it comes to choosing a right therapist and also knowing when to stick with one. So let's take one of these challenges at a time. And we're going to start with, how do you choose the right therapist? The first step in choosing a right therapist is really recognizing and accepting that it's a process. It's going to be a project. It's not going to be 1, 2, 3. So once you accept that, you're already laying down the groundwork for you to now be successful in choosing the right one. So step one is recognizing it's going to take time, you're going to need patience, and it's not a very quick decision, and it's not necessarily going to work out right away. You need to give it the time and patience, but if you're really distressed, if you're really struggling, you're really in distress, it's worth the investment. The next thing is, if you really feel like you don't have the energy for it, it's just too much, and many times people feel this way, because if they're at the point where they feel like they really need therapy badly, they just don't have it in them. And so there's no issue, there's nothing wrong with trying to get help from a close friend, a family, a relative, a parent, a spouse, someone who could help you along with the project of finding you a therapist, finding you the right therapist. Next is, you want to tackle the financial component. So you got to figure out, is this in my budget? And if it's not in my budget, what are my options? One thing to keep in mind is priorities. Sometimes people technically could fit it into their budget, but it's a matter of priorities. And if that's the case for you, then you want to recognize that if you think therapy can help you and improve your life and give you quality of life, how much are you willing? What's the price tag for increasing your quality of life? Or maybe not even only increasing your quality of life, but stopping or decreasing the immense distress that you're in. And so usually, if you think about it, there is a pretty high price tag on that, and that can help motivate you, prioritize it. If it's within your budget, it's just a matter of prioritizing. If it's not within your budget, then there are insurance options you can try to look at, or you can ask therapists if there's any sliding scale options if you want to go private pay. There's no issue in asking, and then you figure it out from there. And many times therapists have sliding scale options. The next thing is, how do you choose the right modality for you? There are so many modalities out there, and how are you supposed to know if you haven't been trained in these techniques and these modalities? And the answer is, first, some modalities are known to be more evidence-based than others, so that could hold some weight. But also, feel free to research. Nowadays that we have access to Google and internet and all that, you could research. Don't feel like it's a mystery and you got to just trust the experts. I definitely recommend patients all the time to research your issues, research what modalities are out there, research which modalities speak to you, and doing your own research will help you figure out which modality you're interested in general. When it comes to finding the right therapist, the right name, there are different ways you can go about it. A great way to go about it is by asking a referral agency. If you go to a referral agency who's used to making these referrals, and some referral agencies are better than others, but if you go to the referral agencies, maybe the ones in your community that people speak about, and ask them, they often interview therapists and they get feedback on therapists, and that's a really great source for knowing who might be a good therapist for you. So you cannot underestimate the impact of going to a referral agency who specializes in this. Next is you can ask a therapist or your friend's therapist for them to recommend a therapist. Many times therapists know therapists, and usually if someone's coming recommended from someone in the field, it holds more water than a random person that you just happen to search or find. Another thing to keep in mind is the person's credentials. Credentials mean something, but not everything. So if someone, for example, is at the doctoral level, chances are they had more experience, more training, more rigorous training, maybe a little more research also, and they may have better skills or be better trained than people without that level. But master's level clinicians can be just as effective and sometimes even more effective than doctoral level clinicians because they may have a more intuitive way of going about things. They may have taken on extra trainings that weren't mandated in school, but they did extra trainings on their own. They could just have more years of experience. And so credentials is a factor to keep in mind too, but of course it doesn't tell the whole story at all. And the last thing I would say about this point is take advantage of free consultations that many therapists offer. Many therapists are offering free consultations, some by phone, some by video. I know in our practice, we offer like video consultations so you can actually see the person. But whatever type of consultation is being offered, take advantage of them because this way you can really get a feel for the therapist of who you might be meeting or who you might be speaking to. And there's a lot that you can get out of a short conversation over the phone, over the video to see if you feel comfortable with them, see if they're familiar with your symptoms, and just get an overall feel. So take advantage of free consultations that people often offer, the therapists often offer. So now we're going to change topics a bit, and we're going to talk about how to know when to change therapists. So it's not a matter of choosing the right therapist, but rather, how do you know when to stay in therapy with the same person or change it? And before we get into this, it's important once again to recognize the challenges in deciding whether you should stay in therapy or not. Same challenges apply. You're in a vulnerable spot again in your life. You're experiencing a lot of distress or dysfunction. You know, you're in therapy for a reason. Number two, you might also feel hopeless because you've been to therapy for so long with someone maybe, and you don't feel like it's really been helping, so you could start feeling hopeless also. You know, also, once again, there's so many options. So how are you to know whether it's the modality they need to change or the person that needs to change? And that's another factor to keep in mind as well. There's a financial component. You already spent a lot of money on it. You're going to spend a lot of money on it. There's a time commitment. You also want to make sure you fit well with the personality. And sometimes it's hard to know, am I just not clicking with this person's personality, or is it something more than just that? Is it their clinical skills? And additionally, there are two more issues that come up, challenges I would say, that come up when you're deciding whether you should stick with a therapist or change therapist. One is called the sunk cost fallacy. And the sunk cost fallacy comes down to this. If you spend a lot of money on something, it's so hard to kind of accept that you wasted that money, and so you kind of start burning your tires and sticking with it and saying, okay, maybe just one more week. Because otherwise you feel like you just spent thousands of dollars on this, and it's hard to accept that. And so many times people, if they invest in a certain stock and it's going down, and they really should get out, but they already lost so much and they spend so much, they want to just wait and sit it through because they can't accept losing that. So that comes up in therapy too. You spend so much time and energy and vulnerability, and you opened up to someone and you made a connection with them. It's so hard to change at that point. So that's another challenge that we're up against. And another challenge is that therapy usually takes time. So how do you know when you just need to give it more time versus when it's time to actually make a change? So these are other challenges that come up when it comes to choosing whether you should stay in therapy or not. And so I'm going to talk about a few things to keep in mind when you're trying to know whether you should stay in therapy or stay with this therapist, I should say, or change therapists. And then we're just going to summarize and we're going to be done for tonight. So the first thing to keep in mind is, like I said before, you have to recognize and accept that it's a complex decision and it's not going to be easy to figure out, okay? So that hopefully will reduce some of the pressure. Sometimes people feel like, I just need to figure it out. Should I change or not? You got to reduce that pressure by recognizing it's challenging. There's no clear answer. It's hard to figure out right away, and accept that first, okay? That's the first baseline thing that you just have to accept. The next question to ask yourself is, who referred me to this therapist, right? And then go back at them and but go back to them and ask them, is this the feedback you've gotten from other people? Like, I feel like I'm not moving ahead. Like, does this make sense? So going back to the referral source can be helpful, but also if it's a reputable referral source that sent you there, then there's something to say about that therapist. Now, they may not be a good click for you, right? But there's something to say about that therapist if you came to them from the right place. Another thing to keep in mind is, have you come any closer to your therapy goals than not? And sometimes people don't make therapy goals in therapy, and that's a problem, because you want to come in with some therapy goals, and then you want to check and assess, have I come some way along towards my therapy goals, and I feel like I just stopped at this point, or am I not really making any progress towards my goals? But trying to think about it in that light, not how you feel each session, but whether overall you're meeting some of your goals, you're getting closer to them or not. Also, are you experiencing less distress in your life? Like maybe you are not getting better in certain ways, but overall your quality of life has gone up. That's something to keep in mind as well. Another thing to ask yourself is, have you gone through multiple therapists? Is there a pattern here? Whenever we see a pattern in our lives, we need to start questioning things, because usually if there's a pattern and the common denominator is you need to ask yourself, is it something about the way I am going about therapy that for some reason none of these therapists are helpful, or perhaps the opposite, where you've had great experiences in therapy and this just isn't it? And if that's the case, it's a pretty easy decision. You know you're a good candidate for therapy, usually works for you, this person's not working for you, it's time to switch. But if you are constantly going through therapists and it's never working, maybe it's a question of how are you going about through the therapy process? And it's not so much this therapist that's wrong, but it's more of a question of like, how do you need to change your approach towards therapy? Another question you want to ask yourself is, are you sticking to the therapy homework? Hopefully your therapist is giving you some homework for the week. And the question is, are you sticking to it? Are you actually implementing what's being spoken about in therapy? Or are you using it just as like a once a week venting session? Now, once a week venting sessions, I think, have a lot of value too. So we're not going to belittle that. At the same time, if you're trying to meet your goals and you're not meeting your goals, and all it is a venting session, but you're not learning new skills, you're not implementing concepts throughout the week, then that can explain why you're not improving in therapy. And if that's the case, you may not need to change therapists. Once again, you might just need to stick better to sticking with the homework. Are you attending sessions consistently is another question to ask yourself. Are you there every week? Or sometimes people, especially early on in treatment, might need like twice a week even to get things really going. Are you attending enough sessions for there to be an impact or not? What I like doing in our practice is, oftentimes I offer people half sessions twice a week. And this way they get this consistency and the motivation stays up throughout the week, even though they're not spending so much time and so much money in therapy because it's half sessions twice a week. So each one is a case-by-case basis, but many times there are ways to enhance the therapy, either through adding a half a therapy session or just doing 2 half therapy sessions, or somehow communicating throughout the week within the boundaries of therapy. You speak with your therapist, what's considered appropriate, but there are different ways to make more of an impact of your therapy. And then last but not least, bring it up to your therapist and ask them, say, hey, I've been here for some time. I don't really feel like I'm making progress. What's going on? And they may say like, we thought about the same thing, and maybe we should try this, that, or the other thing. Or they may say, look, what are you talking about? You're doing great now. And you're not doing great. So there's a disconnect there. But bringing it up to your therapist and speaking with them often helps you gain clarity there as well. And it might also help them change up the structure of their therapy sessions. Maybe they need to focus more on skills with you and they kind of forgot about it or got lazy or whatever, right? Where they just started taking more of the supportive role, or maybe thinking that's what you need more. So sometimes they don't know exactly what you need. So having this conversation can help the therapist maybe focus more on skills, maybe write take-home summary points at the end of sessions. So it's not just that you're meeting that one time per week, but you're actually taking what you learn with you throughout the week. And I do this in our therapy sessions where we have people write down, what are some take-home points for you? What are the messages, the things that you think are really helpful that you want to review throughout the week and really try implementing, and assigning therapy homework? Like based off of this session, what's going to be the therapy homework? So there are ways to enhance the therapy without necessarily changing therapist. But sometimes it is important to change therapists. So you don't want to keep burning your rubber, like keep running your wheels if it's not really helping. And so in that case, you want to think about, do I need a therapist with a different modality completely? Do I want a therapist that within the same modality, let's say CBT therapy, for example, but a different style or different personality? Sometimes it's just not a good click. And yes, CBT, for example, is very skills focused, but you also need that relationship and that connection and feeling comfortable with the person. So you might need to find another therapist within the same modality, or perhaps a different modality makes more sense for you. So to summarize, we discussed the challenges in choosing a therapist, and we also discussed the challenges in deciding when to change therapists. We discussed the importance of recognizing that it's not a simple project either to choose or to know whether to stay or not, and give it the time and the patience that's necessary. We spoke about some of the best ways of choosing therapists, including using referral agencies, which can be really helpful, using therapists to refer other therapists, checking their credentials a bit and seeing what their credentials are, doing some of your own research and figuring out which modality you think clicks best with your personality or your presentation, and take advantage of free consultations that therapists are offering because they're free. There's nothing to lose, and this way you'll get a feel for who the person is, how they work, and ask important questions. Ask questions like, what is their modality? What is their style of treatment? What's a sample session going to look like? What do they think about your symptoms? What diagnosis does it sound like? And these are questions you can ask on a consultation to try to figure out whether this therapist knows your stuff and whether they're a good fit for you, which is also really important. And last, we discussed when it's time to change therapists, and we said, like, you want to see who referred you to them. You want to see if there's a pattern of you never fitting with the therapist, or if you have great experience in the past and it's not a good experience this time. You want to ask yourself whether you're sticking to the therapy homework, you're attending to sessions. You want to bring up this conversation with your therapist and ask them and see if they want to change anything about the therapy or what their take is. And sometimes there just really is time to try another therapist and recognize it's a complex, hard process to go through, but it's worth it in the end. If you're really suffering, you want to give it the time and attention it needs to find the right person. And like I keep saying, take advantage of free consultations because you could get a lot of information and feel for someone if you do. So that's the end for tonight. Thank you all for joining. If you have any questions, you can contact me through my website, adopsychology.com. That's ADO psychology.com. And I also post videos there on all different mental health topics. So if you're interested, you can check those videos out there too. See you next time. Take care, everyone.